And welcome back. I'm Mabel Jong. Thanks so much for joining us. We're your one-stop shop for all of the great content coming out of the World Healthcare Congress here in Washington, D.C. And we are going to be talking about MIT Solve. MIT Solve is an initiative of the Massachusetts Institute of Technology that advances lasting solutions from tech entrepreneurs to address some of the world's most pressing issues. And in our studio right now, we have Patrick Diamond, who is Officer, Health Community at MIT Solve. Patrick, thank you so much for your time today.
Thank you.
So you, each year, solve issues for global challenges, and then you pick a solver team that has really proved itself with the most promising solutions.
Exactly.
So that must be a very difficult task. I mean, what sort of methodology do you use when trying to find these solver teams?
Yeah, so I'm happy to work at MIT Solve. We've been around for about 3 years. And each year we pick 30 or 33 between there, startups, nonprofits, anyone who's using technology to address our challenge topics. We use a lot of different techniques and criteria to pick the teams that we select. We look for solutions from all over the world. That's important to us. Technology is at the core of their work, so we select them based on their use of technology in solving these challenges. And then they all have to have social impact at the core of their work. So they need to be creating not only profit if they're a for-profit entity, but they also need to be creating social value.
And what sort of timeline are you looking for? How long do their projects have to be in place before they can be considered?
Right, yeah, so we select early stage innovations or technologies. So in the for-profit worlds, that can be entities that are in market and maybe have attracted rounds of funding. For our nonprofit entrepreneurs, they typically have some type of product or service in operation. So we're looking for people with a proof of concept before we select them.
Your focus is Healthy Cities Challenge. Give me the background on that and why is it a significant project?
So one of the reasons that we chose, or our community chose, the Healthy Cities Challenge really gets to the growth in population in cities. By mid-century, 2050, we estimate that 2/3 of people will live in cities. And in fact, most people already live in cities right now. And that creates a lot of opportunities for people in terms of lessening the gaps in income inequality and access to economic opportunities for people. But it also certainly causes a lot of challenges too, related to density, violence, air pollution, sanitation, clean water. All of these things compound as people come together in more dense settings like cities.
Okay, so what are you asking solvers to do to address some of those issues?
Well, we take a really broad approach to how we issue our challenges. If people log onto our website to read more about the challenge, they'll see that we're accepting solutions that range from attacking the infectious disease issues related to outbreaks like Ebola and so on. We're looking for solutions that address chronic conditions like diabetes and obesity, maybe through access to food or exercise, green space. We're also looking at violence as a key issue in urban areas. That's a public health approach. That's something that's very much the focus of this conference this week as well, the social determinants. And then, of course, we're looking at equitable access to healthcare services. A key component of ensuring healthy cities is making sure people can access traditional healthcare services.
And can you give us a hint on what sort of solver winners you're going to be talking with in a couple of weeks at your big event? Yeah,
so our upcoming event, Solve at MIT, is our main gathering on campus. It's of our gathering of our community, of our entrepreneurs from the past year. So we don't yet know the entrepreneurs that are addressing the Healthy Cities Challenge. They will select those folks in a few months in September. But we expect that there'll be a variety of solutions attacking each of those dimensions that I mentioned earlier.
And what sort of technology have you really been excited by that you've seen? Because we are hearing at this conference that the role of technology is increasing.
Of course,
obviously. So, what sort of things is MIT focusing on when it comes to healthcare?
I can speak for myself too. I mean, I'm very excited by any kind of technology that helps decision makers, whether they're in corporations or are involved with markets, or policymakers. Any kind of technology that's helping them to refine their approach to addressing these challenges too. So especially around issues of violence, we hope to see digital technologies, data analytics, things of that nature that will help policymakers pinpoint resources to address violence and other health issues.
To prevent violence or to react and address it?
Both, yeah, prevention and reacting, of course, inevitably as things happen.
Okay. Great. This is your first time at the World Healthcare Congress.
Is,
what made you decide to come this year?
Yeah, so this is a great gathering of U.S. Leaders in the health space, but also globally too. I imagine people are coming from all over. But just looking at the agenda, there's a good mix of focus areas between, policymakers, healthcare leaders, innovators themselves. It's a good mixture of approaches to a multidimensional issue like health.
Okay, Patrick Diamond, thank you so much for your time today.
Of course, thank you.
And I'm Mabel Jong. Thank you for watching. Stay tuned. We have many more interviews to come.